Hi everyone, my name is Dr. Kiran Martin. I am the founder and director of Asha, that is working among 700,000 slum dwellers in the city of Delhi. I am here to tell you what is going on with regards to the COVID crisis in India and in the city. Many of you may have heard that India has recorded over 350,000 positive cases in the past 24 hours. Delhi itself has recorded about 25,000 cases within the same period. There are no hospital beds and there is no oxygen, and therefore patients are lying on the ground outside all the major hospitals desperately waiting for a bed, and a lot of them are gasping for breath and expiring simply because of the lack of oxygen. We have no idea when this crisis is going to come to an end. As of now, it is not possible for any patient requiring hospital admission to find a bed or even a place to lie on the ground in any of Delhi's hospitals. With regards to Asha, within the 700,000 population that we are covering, we are determined to do the very best we can to look after every single patient that has been placed under our care all through the 91 slums. We are doing this with the help of our Asha team that is made up of doctors, nurses, paramedics, health assistants, health workers and social workers. In addition, we are also using the services of our COVID warriors, of which we have more than 300. These are young people from Delhi University that have been helped by Asha. However, as you know, this particular strain is a double mutant strain and it is called B.1.617, and this double mutant strain is highly contagious and it is affecting young people. It is also affecting children. Therefore, it is all the more laudable that these warriors who are young are not shying away from going out into the communities and going at the front lines. The entire Asha team and warriors are going from home to home, lane to lane and street to street. This is so that we do not miss a single patient which has symptoms. I wish to tell you that the RT-PCR test is not available at this time in Delhi. Therefore, a diagnosis has to be made based on pulse oximeters and symptoms. Our warriors have been given lots of pulse oximeters, as has our team, and they are going from house to house. Anybody who has COVID-like symptoms, anybody who has fever or upper respiratory symptoms is being treated as a COVID patient. We are treating them with supportive treatment when they are mild in nature, the symptoms, and if the patient begins to deteriorate, then we have made all arrangements to give them nebulization with budesonide, to give them steroids, to give them anticoagulants, and also we are desperately trying to arrange for oxygen. We have been running from pillar to post, but as of now we have not been successful in acquiring either oxygen cylinders or oxygen concentrators. This is a very distressing situation. We are giving out masks in all our slum communities through mass distribution because it has been clearly mandated by the government, and we are also of the view that everyone should wear a double mask. So the 3-ply surgical masks being provided by Asha are being worn over the mask that the patient already has. There are a lot of patients around with dirty masks, and we are encouraging them to discard those masks and wear clean 3-ply surgical masks. We also wish to distribute large scale Dettol soap, and we would like to buy more nebulizers, more pulse oximeters, and we will be requiring sanitizers also in bulk. All the PPE that is required by our team and warriors will be required in large amounts. In addition to all this, of course, we will be continuing to need the drugs that we need to provide these patients depending on the severity of the symptoms. I know that you have stood with us all this time. You have, in the first wave, provided us with resources to do the best we could, and because of that, we were able to save many hundreds of lives. Right now, we have many patients in all our communities having fever and other symptoms which are very highly suggestive of COVID. And we once again appeal to you. I ask you to help us at this time to buy all that I have just mentioned. You can go to www.asha-india.org and on the home page there is a donate button. When you click the donate button, you will be able to make a donation for our COVID work by being directed towards the country that you are from. For those who live in Delhi and those who would rather give in kind, I urge you to kindly consider giving us 3-ply surgical masks, N95 masks, Dettol soap, hand sanitizer, nebulizers, pulse oximeters, budesonide respules, budesonide inhalers, Visolone tablets, Eliquis 5 milligram, and of course oxygen cylinders and oxygen concentrators, if at all you by some miracle find them somewhere. Our team member and driver will be more than happy to come and collect these items from your preferred location, since it may not be considered appropriate by you to leave your home. We will be more than grateful for this type of in-kind assistance. Please remember that we are looking at after 700,000 people in 91 slums. It is a huge population to cover, and every single Asha member is fully committed to being at the front lines to fight this COVID war. We hope that you will fight with us and together we can overcome this. Thank you.